Ask you, since Obamacare was enacted, governors of 31 states plus the District of Columbia have opted to expand Medicaid through federal funding, providing insurance to 11 million low-income people. One of the Americans who benefited from the Obamacare Medicaid expansion is Carol Hardaway of Salisbury, Maryland. Carol?
Thank you. I have multiple sclerosis, but could not afford insurance. Without the treatment or medications I need, I had problems with walking, with my speech, and my vision. When the Affordable Care Act was passed, I moved from our home state of Texas, because they refused to expand Medicaid, to Maryland. And within 2 weeks, I started receiving treatments through Medicaid, and am now well enough to work as a substitute teacher. Senator Cruz, can you promise me that you and the Republican leaders in Congress will actually have a replacement plan in place for people like me who depend on their Medicaid? In other words, I like my coverage. Can I keep it?
Well, Carol, thank you for sharing your story, and congratulations on dealing with MS. It's a terrible disease, and congratulations on your struggles dealing with it. You know, if you look at Medicaid, more than half of the people who've been covered under Obamacare have been under Medicaid. And the problem is Medicaid is a profoundly troubled program. And so it may be working well with you. But I'll tell you, nationally, the health outcomes under Medicaid are really poor. Nationally, 54% of doctors won't take new Medicaid patients. Nationally, dental care appointments for moms are denied at a 63% rate on Medicaid. The denial rate for private insurance is 4%. And Medicaid patients are almost twice as likely to die from medical treatment as those with private health insurance. The solution for people who are hurting, I believe, we should have a system that allows as many people as possible to be on the private health insurance of your choice rather than Medicaid, because the Medicaid outcomes are not working and people are suffering. And what's happened also, it's really quite striking. Because Obamacare dramatically expanded Medicaid, many of the people who had been on Medicaid, many of the people who were really suffering and needy, have found their wait times increasing. In fact, in Illinois, on Medicaid, over 700 people have died on the waiting list for care for Medicaid. So I'm glad that you're receiving health care. I can tell you a great many of the people on Medicaid aren't, and I'd much rather see a system where we can have millions of those on Medicaid getting health insurance. And the only way they can is if we have competition so that rates are lower so that you can afford to have health insurance.
Senator Sanders.